Yes, good morning, wonderful people. It's a lovely Saturday morning. As we dey wrap up for Kukuruku, they tell you, say, I hope so now they giddy up for Health Matter. And here we are. Here we are to do it. We sabi how to do with Dr. Bartolomeo Fegbola. I'm the CEO, Grace Valley Medical Center, also a medical consultant, and is an expert at what he does. He's a certified medical doctor who has been taking us through the journey of infertility for a while now, female specifically, female infertility. So we are going to do a quick recap on what we've done. So let me yield the floor to him to
well, before you do that,
to greet us and
yes.
Good morning.
Thank you very much. Thank you very much.
Congratulations to every one of us.
Thank you, sir.
Congrats
Slimmest
to every one of us.
Thank you very much.
Thank you so much, Doctor.
And to our numerous viewers at home and around the world, we want to say a very good morning to you. But before we go on, I would like Slimity to talk about what we have before us.
Okay, congratulations to you people in particular, because without the viewers, obviously, I always talk on WAP TV, no go every day in existence. So you guys, not just bringing this for us, talking about we 100,000 subscribers on YouTube, but then we are celebrating the second year for Health Matta. Okay, and it's we can confidently say that some people will start with us and they still stay with us up until now. And of course, over the years, we've been able to get new viewers, new members on top of the show. So congratulations to Chief, to Doctor, to us, to WAP TV, and of course to every other person where they watch the show. We are 2 years on Health Matta. And of course, you can see our beautiful cake. Courtesy Grace Valley, courtesy Dr. Bat.
Thank you very much. Thank you very much. Thank you very much.
Thank you, Doctor.
Yeah, thank you. A very big thank you once again to our numerous viewers at home and around the world. Health Matter on WAP TV attends to today.
Yep.
It's been a wonderful experience. We are here because of you. Without you, we won't be here. Okay, so this morning we'll be looking at a topic we started some weeks ago, specifically female infertility. Female infertility. Hopefully today we'll be able to go as far as the treatment, because we actually want to end the topic today so that we can start the next topic on the stage, because around the corner is World Heart Day. Usually comes towards the end of September in every year.
Doctor,
okay?
we are sorry, before we go into today's topic, there was something Chief and I came across yesterday on the paper, on one of the papers, and that was they say it's not advisable to take fruit when you're on medications.
No, to use fruits
to take medication. Maybe like smoothie or stuff.
Person they use orange water, they take swallow.
Yes. Not just. I think specifically it should be for some medications, not all medications.
Not all medications.
Okay, so usually for anti-malaria drug, we usually advise people who are taking anti-malaria drug to avoid the use of vitamin C while they're on such drugs until probably when you finish. Also, people who have some form of malignancies, cancers, are usually advised to avoid anything that contains vitamin C. That's ascorbic acid. Okay, so that's all I can say along that line. Well, this morning we'll be returning to a topic we started some few weeks ago, female infertility. We'll just do a quick recap of some of the things that we have said before, so that we'll maximize our time to get into new grounds.
Well, if you would also like it like that, since it's our second year anniversary, maybe we should also give people the privilege to call in as, if possible, from now.
From the beginning.
From the beginning, so that they will bask in the fury of the celebration too. So please, MCI,
you have my support, sir.
Yeah, keep the phone lines open in the euphoria of celebration and this joy. let us do it together from the beginning. Let's break the law for now.
Yeah, thank you very much. I'm sure if you look at your paper too, you remember that we stopped somewhere.
Yes, we stopped at celiac disease.
No, endometriosis.
So
I asked a question on that.
And you were also answering a particular one I asked. That was on Down syndrome.
Yes. That was also on Down syndrome. Okay, so essentially, we'll be looking at definition, as we always do, types, causes, risk factors, prevention, diagnosis, as well as treatment, and then, of course, conclusion. Now, female infertility is estimated to affect about 48.5 million females all over the world. Okay? And we do know that infertility on its own carries a lot of negative social stigma. Okay, in some parts of the world, couples who are infertile are usually treated in a way that may not be adequate. I don't want to say, because in some part of the world, if you don't have a child, okay, it may deprive you of your family inheritance in some situations, properties, and what have you. And also, children are regarded as wealth. And of course, it comes with a number of psychological trauma to people who are so affected. Okay, so it is a very big topic, and this morning we are here to tell you one or two things you need to know, as well as how to go about it if you're encountering such a challenge at the moment. Female infertility has to do with infertility that affects the female. Of course, we do know that it takes two to tango. It's not just a female that is involved, okay? But having dealt with male infertility before now, we are just narrowing down to female infertility. Now, female infertility, according to WHO, is a disease of the reproductive system in which there is a failure to establish pregnancy in a situation where there's adequate sexual exposure over a period of 1 year for a woman who is below 35 years of age. For someone who's above 35 years of age, 6 months is usually regarded, okay, is usually taken as a point of reference for such people. And as at the beginning we did say there are usually two types of, majorly there are two types of female infertility, okay? So we have primary infertility general, not just the female. We have primary infertility and we have secondary infertility. Primary infertility, we said, is in a situation where a couple have not been able to achieve pregnancy, okay? In some cases, they may be able to achieve pregnancy, but they've not been able to carry the pregnancy up to live birth. So a pregnancy, a couple that has been able to achieve pregnancy but ended up in a stillbirth or miscarriage is also regarded as female infertility. And of course, secondary infertility has to do with a couple who have been able to achieve live birth in time past, but subsequent effort to have more children proves abortive, okay? Now, having said that, we talked about a number of causes of female infertility, and we've looked at a number of them. We mentioned causes like, okay, let's take it this way. We mentioned causes along the line of...
As genetic acquired.
Yes, acquired and genetic, as well as causes that have to do with locations. Now, causes that have to do with locations, we mentioned since the location, hypothalamic pituitary axis, that of course have to do with the brain, okay? Challenges along that line can cause female infertility. When a woman has challenges with high prolactin level in the body, prolactin is a hormone that is responsible for production of breast milk. When a woman has excessive production of prolactin, that can affect fertility. Okay, so as we are coming lower down, you get to ovulation factors, okay? Now, before ovulation factors, I also want to mention that age is important when we are talking about...
Age menarche.
Yes, when we are talking about infertility. Age factor is important because a woman's fertility peaks from early 20s to about mid-20s. From 27 years of age to 30, a decline begins to occur. And of course, just like what he mentioned, menarche is the age at which a woman or a young girl begins to see her menstruation. And of course, when you're talking about age 2, we have challenges that may have to do with premature menopause, okay? Now, just like we have premature ejaculation, there's also premature menopause. And but before that, what is menopause all about? All of us have an idea, even our viewers will have an idea when we mention menopause. Menopause usually happens within the age bracket of 45 to 55 years, okay? Some women may be seeing their period even when they're about 60 years of age. That have been recorded in history, okay? But when one begins to see her menopause before the age of 40, is regarded as premature menopause, and it is also not normal. It's abnormal in the sense that it carries with it a lot of risk, cardiovascular risk. People who have such challenges are predisposed to cardiovascular risk, like heart diseases, heart attack, and what have you. But what is menopause? Absence of menstruation for at least 12 calendar months. That's 1 year, okay? And this, of course, comes with advancing age. So age is important when we are talking about infertility. And of course, there's also still on age, as a woman is advancing in age, that's what we refer to as ovarian reserve. At birth, a woman has the highest number of eggs in her system. Okay, but because of the fact that she sheds one on a monthly basis, it declines over time, it declines over age. Not just the decline. Apart from the decline, there's also the loss of quality, okay, of the eggs that were produced when one was much younger will have higher quality than the ones that are produced when one is hitting on the north side of 40. Okay, so that also can affect infertility. Okay, so even when someone is going for IVF, in vitro fertilization, a form of treatment for infertility, age is also a very strong factor. As a matter of fact, the age of such a patient will determine what mode of treatment such an individual could be offered. Okay, we'll still say a number of things along that line. So apart from the age factor, we also have the ovarian factor. Now, the ovarian factor is said to be responsible for a large percentage of cases of infertility in the female. Okay. Now, ovarian factors, we are looking at challenges that will affect ovulation, that will make a woman to ovulate infrequently or not at all. If a woman does not ovulate at all, we call that anovulation. So there's also anovulatory infertility. Okay. Now, what are the challenges that can affect a woman's ovulation? Where we stopped last week is one of the causes, endometriosis. And of course, I can remember that somebody called in to ask about endometriosis, and she also said that she currently was diagnosed with such a problem. What is it all about? Endometriosis, I will shed more light today on it, it is an abnormality that has to do with having endometrial lining that ideally usually should be found within the uterine cavity, inside the womb. Okay, so when you have it outside of the womb, okay, it is regarded as endometriosis.
When you have it outside the womb?
Yes, outside the womb.
Outside the womb?
Yes. Ideally, the inner covering. Inside. Yes, it covers the inner aspect of the womb. Okay, so the endometrial covering. But when you have it located, it's an abnormality to have it located outside the womb, within the pelvis. Okay, when you have it outside the womb, it causes a lot of trouble. Okay, one of which is the fact that when a woman is menstruating, that aspect of the uterus is actually the one that is responsible for menstruation. Okay, so when a woman is menstruating, menstruation can equally be occurring outside the womb. Okay, not just inside the womb. Now, but the difference is that the menstruation inside the womb will have an outflow. Of course, it will come out through the female reproductive organ, and the one we see from a monthly basis, and a woman uses tampon and pad and what have you. But in a situation where you have that occurring outside of the womb, among the pelvic organs, there's no outflow.
There's a problem.
There's a problem. Okay, so what causes endometriosis? Okay, now, but before I go to what causes endometriosis, let me talk about some of the symptoms of endometriosis, so that anybody who has such a challenge could actually start thinking along that line. Okay, so endometriosis usually are in stages. Okay, but stage 4 of endometriosis, stage 4, will come with a number of symptoms. Number 1 is painful menstruation, painful sexual intercourse. In fact, a number of women are said to witness pains even when they are urinating or defecating when they have endometriosis. Okay, so and usually these pains hovers a period shortly before the one begins to see her period, while the person is seeing her period, and then after the woman must have seen her few days after the woman must have seen her period. Okay, so the causes are said to be acquired as well as genetic. Some people whose mother may have such a problem, may have had such a problem, may also, the females now, may end up having it. But that said, the number of things too that are regarded as some of the causes.
Other causes.
Other causes too to this problem. One of which is retrograde menstruation. Now, if you're regular on the program, you know we talked about yes, retrograde ejaculation when we're dealing with male infertility. So now we have on our hands retrograde
for male ejaculation, for female
menstruation. Now, what is it all about? Ideally, when a woman is menstruating, the menses should ideally flow, out of the body through the vagina. But in a situation, in some cases, you may have the menstrual flow tracking up towards the tubes, the fallopian tubes on either side of the womb, and carrying along with it some cells of the uterus. So when that happens, instead of coming out, it enters into the pelvic compartment and it plasters there. And of course, that is one of the causes of
endometriosis.
Endometriosis.
So that is where we are going to let you take a chill pill, sir, so that we can go on this short break. And Health Matta, we'll be right back. Go nowhere.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show wey dey help people. Terms and conditions apply sha o.
For advert placement and sponsorship, make una call Stella Maris on top 070 3914 5229. Rebecca 070 6969 1950.
Welcome back. We are on the causes of endometriosis. It has actually made us realize we have acquired and genetic and some other causes that could be adduced to endometriosis. But if you are just joining us, well, don't be astonished for the cake we have here. Help us zoom on it. We are 2 years today on Health Matta. Let them know.
We are celebrating, of course, our 2nd anniversary on top Health Matta. Okay, so that's now why you see the cake. Very unique kind of cake. Anyways, it's health. So you see all the stethoscope. Doctor, there's no injection on it. This pen is for chief.
Yeah, because usually
and there's the
usually right.
There's a card in our mouth.
Okay, is this thermometer?
That's thermometer.
I was thinking it was a pen. Is it thermometer or a pen?
That's the thermometer. That's the thermometer flat there. Then you have the pens.
Okay. Anyways, congratulations to us.
Yes.
Okay, but one funny question, Dr. Bat. You see, there are some questions we might feel are not necessary, but you'll be surprised that when you encounter them in current affairs, maybe while you are writing an international exam, you'll now be asking, why didn't I ask this? So, sir, we know you doctors use red and blue. Just like in school, they use red and blue. Now, blue means you pass, red means you fail. In the medical world too, does it mean that blue means he's still alive? Red, nothing dead, he's dead. Does that really mean? No, it doesn't matter.
No, that was on a lighter note. Okay, actually, the reason why doctors use red and blue pen or even black, usually any write-up that a doctor wants to flag, wants to highlight, you have to use red. Okay, so I've worked in some hospitals. Usually for most doctors, operation notes.
Oh, it's red.
Yes, they use red so that you can easily see it, read the instructions and read the findings and everything. I've also worked in a number of hospitals where if you have to copy the lab investigation, the results, you have to use red. So essentially, it's just to flag it.
Okay, I think in law too, because the aspect of law that I did, you write with blue, but when you have to cite cases, you cite with red biro. So I think your sister. Yeah, so that's why the two of you stay more in school than us.
Thank you very much. Okay, so we are still on ovarian factors. Okay, so and we talked about shortly before we went on break endometriosis. Okay, but very quickly, I will talk, say one or two more things about that, and then we'll move over to some other things. Now, how is the diagnosis of endometriosis made? Usually as a result of the symptoms that the patient is presenting with. The number of investigations that a doctor can order to make a diagnosis, among which is pelvic ultrasound. Okay, but the diagnostic tool of choice is usually an imaging technique, MRI. magnetic resonance imaging.
When you image, sir, which I want to believe you've seen such a patient before, is there usually a blood log in the pelvis, or it usually dries up with time?
Thank you very much. Thank you very much for that question. You actually opened my mind to a number of other things. Now, in as much as I'm coming to the question, but I also want to have blessing from Bielsa. Blessing, good morning.
Blessing, good morning.
Good morning, doctor.
Yeah, good morning, Blessing.
Well, join us. We are celebrating 2 years. So open your mouth to cut your cake and send to you.
We have a prize for you, being our first caller for today.
Oh, they say you have a prize.
We have a prize for you.
Yes,
Yes, so call me after the show.
they will get our number.
Yes.
Okay.
You've won yourself something. So you will see the doctor's number on the screen. Please feel free, call, and
I think they should just take
he's
if
a man of
everybody's
his
going
words.
to call. Everybody will just call. You know with the real blessing. MCR will collect your number though. Oh yeah, so go on, get question.
Okay, I have a question for the doctor.
right,
Please
then.
go ahead.
Okay, after my first baby, my period has been very irregular for like a year. But recently, I've noticed that it doesn't really flow very well. She's over a year now, but it doesn't flow very well. If it should start today, it could not, it just give me sign, and it might not flow the whole of that day till the next day.
Okay. Now, I have a question for you. Hang on, ma.
Okay.
What mode of delivery was your how did you deliver? Was it vaginal
Natural.
delivery or
Yes,
cesarean
vaginal
section?
delivery.
Okay, vaginal delivery.
Yes.
Okay, thank you very much. Now, I asked that question so that it can give me a clearer picture. We've seen such things, oftentimes we encounter that a lot of times. After deliveries, it takes a while for a woman's menstrual flow to return to what it used to be, okay, prior to the pregnancy. Okay, but in some cases, it may persist. Okay, but what I have to say is that you shouldn't be worried if you see it on monthly basis. You shouldn't be so, that shouldn't make you to raise an eyebrow, because it won't stop you from getting pregnant should you wish to have more babies. Okay. Thank you very much.
Okay. Doctor, please, still talking about menstruation and stuff. Now, is it true that if you experience painful menstruation and heavy flow, you're going to have an easy birth? No, seriously, that's our belief. They say what they James, stop, Joe. No, seriously, doctor, because they feel like when you are going through pains during your period, be like, it's good they're experiencing it now, because once you want to give birth, you don't have heavy pains.
Other side of Ajao.
No. I don't think there's any. It's not.
So it
true.
does not relate.
No, it does not relate. As a matter of fact, the endometriosis we are talking about is one of the reasons why a woman could have heavy menses. We refer to it as menorrhagia. Another reason why a woman could have heavy menses is uterine fibroids. Okay, so that can also happen. But I don't want to lose sight of the question that she
sorry,
asked.
I'll ask that question again,
yes,
but
please do.
still speaking on menstruation and linking it with our caller, when she talked about shortage of
we have blessing.
Another blessing.
Wow. We are blessed.
Blessing. How you
All the
doing?
blessings are calling.
How you doing, blessing?
Good morning.
Good morning. You are our second caller for today, and we are celebrating. So you have a gift from me.
Yes, so for the first 5 callers, we have a gift, all of you, from Grace Valley Medical Center.
MCR, I hope you are taking the numbers, please. Take their numbers.
First 5 callers. Courtesy of Grace Valley Medical Center.
Don't worry.
Blessing, oh yeah, you get question. Congratulations to you.
Yes, I beg, since almost 2 months now, I've not seen my period.
Okay, hang on. Have you had children before now?
Yes, I have 2 children now.
Okay. Your last delivery was how long ago? What year?
No, my second baby is a year and 6 months now.
A year and 6 months. Now, before you started having children, have you had such experience before?
No, because I did something. Let me open up to you.
Okay.
Can you hear me?
We can hear you.
Okay, like July, I did I just taking, so I took drugs.
Okay, you took what?
Flush.
I took drugs. I taking, so I took drugs to remove the baby.
Okay, what drug was that?
This quinine, Apple and say.
Okay. Go ahead.
So he didn't come out, so like August 1st, August 2nd, so I now took another one, so the thing now flew. But since then till now, since then till this date, I've not seen my period. But the thing will try to come, I will see a little blood on my pants, but it will not come. So I don't really know the problem. I've done tests, there's nothing.
After taking those drugs, did you return to the hospital for evaluation?
No, I didn't.
I think that was a mistake, because last week we were talking about stuff like that. Okay, it was before now. Thank you very much. But let me answer your question so that I cannot deviate. What I will ask you to do is what we refer to as watchful waiting in medicine. Okay, so you may not bother yourself. Hang on for a while. After about a few months, everything will return to normal. But if that does not happen, please go and see your doctor for proper evaluation. Okay, because last week when we were talking about, someone asked a question, and of course we have to stray into that area. Okay, so because those are the realities on ground. Before now, a lot of females were endangering their lives. We get plenty of stories on uterine perforation.
People gave a case study last week.
Yes, people who even for people who are not medically oriented, okay, they all try to do all sorts, and a whole lot of things were going wrong among our young female adults. Okay, but things are beginning to change, in the sense that the in thing now among them is to take drugs. They don't usually go to patronize those people that will carry out invasive procedures that oftentimes will end in post-abortive sepsis, uterine perforation, and in some cases death. A lot of people have lost their life through that means. Okay, so now the trend has changed to taking of drugs, which for us doctors is even a positive one, okay, because it will help to cut down on the number of complications that they will have, that females will end up with. But that said, it's not as if anybody is encouraging any of those things, but I'm concerned about the health aspect of it. Okay, so but if you get into such and you're bleeding excessively, like I did say last week, please
go to your doctor.
Run to your doctor for proper evaluation, okay, so that your life can be saved.
Okay, the question Slimy asked vis-a-vis the one our blessing asked, our first caller, sir. When a woman is, this time around now, she talk about shortage of menstrual flow, which I've actually come across before as amenorrhea. Sir, amenorrhea, is it not supposed to be a disease for women? Because now you gave Blessing this assurance that there's no
everything
problem.
Everything might return back,
But I feel when a woman is having shortage in menstruation, it is amenorrhea and there's a problem. Or what do you think, sir?
Thank you very much. You are truly an e-doctor. Amenorrhea simply means absence of menstruation, menses. Usually that can, of course, happen in pregnancy. When a woman, you often hear, doctor, I missed my period. It has ceased. It has stopped coming. That's amenorrhea. Okay, so, but that said, it can happen also in a number of problems, okay, that we're talking about under female infertility. Now, when a woman is not seeing her period, it's not likely that that person will be ovulating, okay, because if you don't see your period on monthly basis, it's also not likely that you're going to be ovulating. Why am I saying that? What happens within the womb, within the uterine cavity, is a mirror image of what happens in the ovaries. Okay? As a woman is seeing her period,
that means her egg is broken.
No. Okay, now let me explain, because I'm looking at time. I actually want to move faster. Let me explain what happens in menstruation. Now, in menstruation, the inner lining of the uterus, okay, they're in layers. When a woman, at the beginning of the menses, that inner lining that are built up to receive a baby, that became disappointed because there was no baby coming, will dismantle itself, disengage, and those debris and the blood vessels that went into those layers will be broken up. Those are the things that will cause bleeding. And then that is what you see as passage of menses that a woman sees. Now, as the woman is menstruating, God is a wonderful God. The nature, the ovary at the same time is trying to push out new set of eggs that will begin to grow. By the middle of that cycle, I'm talking about for a woman who probably has a 28-day cycle, one of the egg will attain full maturity and it will be released in one of the ovaries as ovulation. The egg will be pushed out as ovulation. If at that stage the woman meets a man, okay, and there is fertilization, the system will prepare to receive the baby. The womb will prepare to receive the baby. So that thing you see that gets dismantled are actually the preparation that the womb has actually done to receive a baby. But when none is coming, it gets disappointed and it dismantles it. So as those things are occurring within the womb, the ovary too is looking at what is occurring in the womb, and of course he's doing his own job. Okay, so those are just what happens. Thank you very much.
Speaking of the blood logs, sir.
Okay, so still on ovarian factors, we have polycystic ovary disease. We have Esther from Kwara. Esther, good morning.
Number 3.
The women are calling today.
Is that topic?
One Esther.
Good morning, Esther. Are you there?
Hello, good morning.
Yeah, good morning, my sister.
Thank you. We enjoy your program.
Thank you
Thank
very
you very much.
Thank you very much.
Yes, I'm here. Good morning.
Yeah,
Are you calling to... Are you calling to receive
just to register
or to register yourself as the number 3 winner for today?
I want to ask a question.
Okay, go ahead.
Go ahead.
I want to...
Your volume is loud though, Esther.
The question is about this family planning.
Okay.
I had one, this implant at my left hand side. And I discovered the first one I had for 3 years was okay. My menstrual period was okay for the period of days. But the second one I had for another 3 years, I discovered that at times I may menstruate for 2 weeks. And at times it may be for like 10 days above. And I don't think that is normal. That's why I'm calling for enlightenment.
Thank you very much. Thank you very much for that. I'm all smiles because I encountered that question just yesterday. As a matter of fact, I removed an implant from a patient as well as reinserted a new one. And of course, it was a 3-year implant-ons specifically. Okay, so now the challenges they usually have, it differs from one person to the other. Okay, so that's why after the procedure, we'll usually give you the leaflet so that at least when you go home, you can read and digest it and know what to expect. Okay, but it differs from one person to the other. So in some people, they may be having heavy menstrual bleeding, okay, oftentimes necessitating them to go back to the hospital to make complaints along that line. Well, if you're still having such a challenge and you feel concerned, please, I would advise you return to your doctor. There are ways and there are some other medications we can give to have it corrected. Thank you very much for that question.
Okay.
Okay, so polycystic ovary disease. We are still on ovarian factors, okay?
We are still on ovarian factors.
Yes,
okay,
we have mentioned that before. Polycystic ovary disease is one of the causes of, in fact, it's been said that 30% of females that are battling with infertility may have challenges with PCOS, polycystic ovary syndrome, okay? Now, what is it all about, okay? Cyst is just like saying bag containing, multiple bag containing water. Now, what you have is in the body of the ovaries on either side, you have multiple cysts. You may have multiple cysts on them. Like I said last week, it's not all women. Problem. Yes, it's not all women who have those multiple cysts that will end up having polycystic ovarian syndrome. Okay, so now the PCOS can be inherited from one's mother. Okay, it runs in some families. Okay, but that said, essentially, people who have this challenge, usually they may have truncal obesity. They may have higher than normal, higher than normal level of hormones that a female should have. And oftentimes you discover that they will have beards, they will have baldness, they will have hairs, loud voice, just like a man will have and all that. Okay, so it can actually cause irregular ovulation. Okay, or in some cases, not at all. Okay, but people who have that, they can get treated, and of course, they can still have children. Okay, so that's all about polycystic ovary disease. Then there's tubal factors too. Okay, infertility that affects the tube. Now, any problem that can cause the tube to become blocked, this can happen in people who have suffered poorly treated or untreated sexually transmitted infections like chlamydia, which oftentimes may not be showing significant symptoms. It may just be showing some form of vague symptoms. Or people who have suffered gonorrhea that was not properly treated, such people could have tubal blockage. What it means is that the fallopian tube becomes blocked. Okay, now when it becomes blocked, you have challenge with infertility. The sperm that comes into such a woman's reproductive system, because of the blockage, may not be able to get to the egg. To the ovary to fertilize the egg. In some instances, where they manage to get through, the developing zygote or the embryo that is trying to track down after having been fertilized at the tube, that is trying to come down again to get implanted in the uterus, could get blocked, it could get trapped, and of course that can cause ectopic pregnancy. Okay, so there are other factors along that line. Okay, but
sorry, sir, we have a caller. Musa from Brno. Musa, your fourth caller. Congratulations to you.
Thank you very much.
Yeah, so don't worry, you hear from us. So any question?
Yes. Good morning. Good morning, Ogato.
Good morning, my brother. How is Borno this morning?
Borno is Blancam.
You are.
I enjoyed listening.
Thank you very much.
Thank you.
That Duria.
You're really enlightening people.
Thank you very much.
Yes. My question is the explanation you did about six. I don't really get that.
Is it polycystic?
Okay, cyst. Okay, okay, thank you very much. Hang on, sir, so that if you have any other clarification, poly means more than one. Okay? When we say poly, we mean polycysts, we mean multiple cysts. We mean cysts that are more than one. Okay, so usually in some females, they have cysts. And like in a way a layman will understand, cysts are just like bags that contain some fluid within it, not just water. Okay? Now, they can be found on the surface of the ovaries on either side of the body. In some people who have polycystic ovarian syndrome, which I say such people are individuals that are genetically exposed by way of probably what they inherited from their mothers. Okay, those people will have the syndrome. Having the cyst is not the same as having the syndrome. Okay, that when people have such syndrome, it causes infertility in that it affects ovulation. Okay, so that's what I say. And for you to become pregnant as a female, you need to ovulate. In a situation where you don't ovulate, there won't be any egg for the sperm to fertilize, even if you have you're exposed to if you have coital exposure. Okay, thank you very much, sir. I believe I've dealt with the question, sir. Okay, so the other causes along that line.
I will quickly ask a question, sir, so that before I know we don't have the luxury of time. Where a woman,
because I promise we'll go to
where a woman's body cannot retain semen. Now, what they usually call the retrograde, where
no, it's not retrograde.
I borrowed that word that's coming back. It goes and comes back. So, pardon me to use it in English term now. Where it goes and comes out, does it have to do with ovary or?
Is it the men?
Is it the men? Thank you. I wish shifting that blame to the men, where the sperm is quality now, but some women's body cannot retain. Are there issues where a woman's body cannot retain?
Yes, they are. They are. It's a medical question. Thank you very much. It's a two-pronged issue, really. Okay, so men who have poor quality sperm, watery sperm, it could easily flow out. Okay, but that is not to say that, of course, for people who undergo seminal fluid analysis, when we ask them to produce sperm and they produce sperm in the hospital environment, when they bring it to the hospital, it's usually thick. I'm talking about someone who has normal quality sperm. It's usually thick, just like a picture you have if you make starch. Okay? It can be that. Now, the volume should hover between 2 to 5 mils. If you leave that sperm on the desk, probably in the lab, for about an hour. When you come back, it becomes water. It has undergone liquefaction. Okay, so that is what happens during sexual intercourse. The sperm that has been deposited in the reproductive system of tract of a woman will undergo liquefaction after a while. That liquefaction is to enable it to move. Yeah. Because if it's as thick at that the
first 5 minutes,
the movement will be difficult.
Mobility issue.
So, but that also said that's what we refer to as cervical factors too. Cervical factors in the course of that can cause infertility. Now, these cervical factors impede the movement. That is from the body of the female now, not just as a result of poor quality of sperm. Okay, so there are factors in the body of a female that can hinder the motility, that's the word, the movement of sperm in the body of the female. Thank you very much.
You're welcome.
Okay, so now, the other things I want us to quickly talk about is diagnosis. Now, how are the diagnosis of infertility made? Okay, so we'll move with speed. Essentially, you need to do history taking, clerking, and then physical examination. Now, when you do clerking and physical examination, you already have an idea of where the story is headed to. Okay, so that will inform the investigations that you need to order for such a female. Okay, essentially, in ordering investigation, we'll look at laboratory investigations as well as imaging investigations. Okay, among the lab investigation that you can do to pick out the causes of infertility, number one, you want to send such a patient for simple tests as simple as urinalysis. That can show you if the person is diabetic. That can show you if the person has UTI or harbors any infection within the urine. Fasting blood sugar, it can also show you if the person is diabetic, full blood count, okay? And as well as hormonal profile, okay? Now, in doing hormonal profile, we do not just order a female to go and do hormonal profile. We usually order for it to be done on some specific days, okay? So for a woman who we want to do a hormonal profile for, we prefer it to be on the second day of her menses, okay? Now, what are we looking at? We are looking at, sometimes we look out for 5 parameters. We are looking at FSH, estrogen, and then some other hormones. And also at day 21, we expect such a woman to do to go back to the same lab to do an estimation of the progesterone. Okay, these are another hormone that are useful in reproduction, found in the body of the female. Now, the FSH and estrogen are 2 hormones that can help enable us as clinicians to assess the woman's ovarian reserve, the number of eggs that the woman still has left in her system. That's what ovarian reserve is all about.
Okay, you won't rush us because you want us to finish. Quick question before we go. Last one, number 1. You quickly talked about diabetes, sir.
No, we still have some time.
Between sugar, between the lab and the urinary, between fasting sugar and urinary, which one is more effective for diabetes, sir, for a man?
Both of them. Fasting blood sugar will show who is diabetic. Urinalysis can also show us.
Which one is more effective, sir?
Both of them are equally as effective.